Do nasal aspirators work? A stuffy nose in babies can make a parent's life miserable. It makes breathing difficult for babies, which results in crying spells. These bouts of crying can make matters worse. One way to provide relief for babies is to use a nasal aspirator. What is nasal aspirator? A nasal aspirator is a small device that is used to clear a baby's blocked nose. It uses suction power to draw mucus from the baby's nostrils and relieve the baby from a stuffed nose. The nasal aspirator consists of a small bulb that is attached to a syringe. The bulb is first pressed to squeeze out all the air from inside. The other end of the syringe is then inserted into the baby's blocked nose, and the bulb is slowly released. This sucks the mucus into the syringe. The syringe can then be pressed to take out the mucus on a tissue paper. Please subscribe and click the bell icon so you stop missing out on important news and resources for parents. Do nasal aspirators work? One of the biggest concerns parents have about nasal aspirators is whether they work properly. If the mucus is very hard or deep inside the nose, it will be difficult to extract it with a nasal aspirator. In such a situation, you should put a few drops of saline solution to loosen the mucus. Loosening the mucus makes it easy to suck it out using an aspirator. If the aspirator is not the right size, then it might be difficult to suck out the mucus. For the aspirator to work, the tip of the syringe should fit perfectly in the baby's nose. If there is a gap while inserting, you may not get the proper suction. To get the best result out of a nasal aspirator, make sure you purchase the right size depending on the age of your baby. You should also physically examine the aspirator and ensure that there are no cuts or tears in the bulb. As long as you check these things, a nasal aspirator does work to help your baby with their stuffy nose.